Well, many people are doing anything they can to avoid going to the hospital for non-coronavirus issues. But what should you do if you have a serious medical condition? Joining us this morning is President and CEO of the Maryland Hospitals Association, Bob Atlas. Good morning. Thanks for joining us again.
Good morning. Hello.
Hi. So let's go ahead and start before we get to the medical issues with the coronavirus situation. About 1,500 people are hospitalized across the state. How are the hospitals doing right now?
Hospitals are doing well. We have some hospitals that have a lot of COVID patients, but for the most part, everybody is under control and managing with what they have. We actually have 1,460 COVID patients, a little fewer than you mentioned. That's down from a week ago where we had 1,640 patients in hospital. So we're down almost 200 or more than 200.
Yeah, listen, at a time like this, every single number counts, that's for sure. So if someone has a medical situation and they do need to go to the hospital, what should they do? Because I think that we have been, we're finding that more and more people are afraid to go to the hospital right now.
Right, and they don't need to be afraid to go to the hospital. Hospitals are safe. Their infection controls are very good. We're actually seeing a growth in the number of people in hospitals for non-COVID conditions. About a week ago, we had under 4,300 inpatients in adult beds in hospitals for non-COVID conditions, and now we have about 4,600 in hospitals. So people are going. The deferred care is beginning to be provided, and that's a good thing because we don't want people to be staying away when they really need medical care. By the same token, emergency rooms are still flat at about 36% of available capacity in use. That was about the same a week ago and several weeks ago. And so we are concerned that people who have emergency conditions are not seeking treatment, and they really shouldn't.
So another concern, though, is the number of hospital staff being furloughed right now, or the fear that some hospitals are actually going to have to close because they've not been used to the capacity that we thought that they were going to be used because of the coronavirus situation. So what do you do in terms of that in the state?
We don't have any hospitals in Maryland that are at risk of closing. Those stories are true around the country. In Maryland, we have pretty stable system of financing for hospitals, which is unique in the country. I'm not going to say that hospitals are not hurting financially, but all of our hospitals are in good shape. I don't think we'll see any closing as a result of this situation at all.
All right. Well, Bob Atlas, thank you so much for joining us this morning. We certainly appreciate it.
All right. Good to be with you.